Okay, this is Dr. Bill Wyatt with the American Orthodontic Society, and we're going to talk some about Electrosurge and show a case here where we did this and then show it several years after we got through with this. Now, I need to get, this is a gentleman that had 2 impacted cuspids. They were laying up behind his upper central teeth like this. Now, he had been through orthodontic treatment by somebody who just didn't pay attention to the x-ray. They didn't even tell him that he had these impacted teeth in there, and that's not what we want to do. So I'm going to show you this guy after we got him. My son had this guy in his office, it was one of his patients, and he saw these impacted cuspids, and the guy had just finished orthodontic treatment. And so this is what some people do, just leave them there rather than try to work with it. Now he put these deciduous teeth, he fixed them in place, and you wouldn't hardly see it, but you've got 2 big old impacted cuspids laying up in here somewhere, coming down, one coming in this area, and they're right behind the central teeth like that, and they just left them there. And so, and the guy wasn't irritated with it at all, so we had to start over with the whole case and go after these teeth, or you could get a follicular cyst around these teeth, and it could screw up his whole mouth full of teeth if you got these big cysts and didn't take care of them properly. So you need to go after these impactions. You either need to get them out, or you need to plan to treat the cysts that will finally develop around the epithelial tissue around the tooth. The follicle is already there. Okay, let's go. This is the case. This was 1985 now when we started the case, and we're going to take these out. We're going to open this space in here and make a space for it. And these 2 cuspid teeth were ankylosed, and so I had to send him to a surgeon to uncover them and then luxate the 2 teeth. You could do it yourself, but I like to have a surgeon do it. Now here he had a little problem there, and between the teeth there we had a problem. Now this is a pretty bad x-ray that we took, but you can see the cuspid tooth in this area right here. And here's the cuspid tooth over here. I'll erase that so you can actually see the tooth, but you can see them in there. Now, now these are baby teeth, so we're going to take them out. And that's no problem at all. And we're going to open this space up more for these teeth to come in. And we'll bring them in place and move them down in here, and I will show you the opening that we had on this young man. Now there the teeth are again, and what we were going to do is go in and bond another hook on the tips of these 2 teeth and move them into this hole. And this was before we figured out the best way to do this, and so I had to use spray in both areas in there, which I didn't like to do because I didn't have a space over here. So we had spray going across here, opening this gap up, and the same way over on this side, and we bonded the hook up in here. So let's see, we opened this up, and we put a spring in both areas, and we pulled another spring going up to the teeth in the back side. Now I'll show this a little more. This is 1986. Now, here are the two cuspid teeth that were ankylosed. And so I had the old surgeon go in and kind of shake them loose, and then we started putting pressure on them to pull them in. I tried using spring to start with, and we would pull this up, but then that wasn't it. So we worked out this system during this case right here to put a spring over here and run dental floss down and hook to the tooth right there. That's where that was born. Now on the bottom, we lined all the teeth up and held them in place while they were pretty well positioned. Now when you trim this with your Electrosurge, we go around and just uncover the tooth, but don't cut in like this. Leave some tissue between the teeth. This will fill in, and you'll see. Just go ahead, you can uncover them, but don't go up to the tooth too close. Now I think I bonded this on, but this is wrong. It should be bonded right up in here, and we use a little lingual button to do that. And then we'll hook the dental floss to those teeth now and pull it out with that. So we were pulling with this spring, and that's the awkward way to do it. But the dental floss works much, much better, and you put your hook really just as close to the tip as you can get it, because it helps the tooth curve, and we don't have to put it back in that direction. And so that's what we did. Now on the bottom, we just lined it all up and got it going. We used a little wing brackets here, used double brackets, I think, back on the side, and we didn't have to do much to those teeth at all. Now here we are pulling these teeth in this direction. Then I have to take this spring, put it up here and cut a little bit off and tie it again. So we kept using the spring, pulling them out to the outside. We got them out after a way. Then I tried taking the whole spring, going all the way and then going through a loop in the wire right here and going to them. And that's where we got the idea of using dental floss here, and then that spring, cut it off here and put it up about here. It'll give you about a half pound of pressure pulling on those teeth to bring them into place. And that's where the thing we rigged up came from. We figured it out here. And I just take a spring, about a close call spring to here, and we hook the dental floss, pull it up to here, and you get as much pressure as you want, really. And now we had him hook a deal up here and put it. Now with the one we're pulling, it pulls the arch forward, and now this doesn't. It pulls this bottom arch forward a little bit and pull them together. So here now we pull these teeth over beside the lateral. We have a place for. If you'd been right on the tip of these teeth, it's much better. It swings and root around and pulls it into place better to pull them in there. So we get them up in here, and now we learned that we put a spring back here and tie dental floss. And this is where we learned how to do this method that we figured out, and that's the way we do these impacted teeth from now on. And this was 1986 when I came up with this. And I carried a typodot with it on it and spoke up in Washington State. And it was in somewhere where somebody lifted my typodot with that over there. So somebody may be doing this type of orthodontics up there. Or we continue to pull with that, and we pull the teeth on in. Now here we take a spring, tighten it back here, and we stretch it about that far and put the dental floss. This is the best way that I know of to bring those teeth, and you draw a little circle here. This really should run through there, and you pull that tooth right to that point. Again, we had to figure out where we would put this loop, where we'd open up this gap, and we'll pull that tooth in there, and we got them up like that, and now we put a bracket on them, on the front of them, and put it in. And if you're smart and you bring it in, you pull them a certain way, you can turn them a little bit while you're pulling the teeth there. Now we pull them right into that place. Now we get them up here down an elastic chain, which will rotate the tooth in this direction. We'll rotate it. Now we can close these gaps up. On the bottom, now we close them up, and this is 1988. And that tooth is that way, and we brought it around. Now the teeth are lined up here, and these cuspid teeth came from here over to here, and we hooked them up in that position. Now we close the gap in here, and bring it in and line the rest of the teeth up. And there this cuspid is. This is the lateral, and the cuspid's right here. And this is the first mouth, second mouth, and the other teeth. Now here's 1988, and these are ankylose teeth, and you see this area that you can cut away the tissue in the palate. Just stay away from the edge of the tooth. It's hard to get a reattachment there. So when you go after the tooth, try to stay away from the edges and go after it and make a hole like that. And you can do impacted teeth. I like to use Electrosurge to do it, and that's where it comes in handy, like that. So here the guy is. This is that. Let's see. We put a bonded 3-to-3 on it, and here he is in 1998, and the teeth are still there. These are the two cuspid teeth. This one could have a little bit more torque to it, right there. But that's 98, and it was 80 something when we started. And there's the tissue in 1998, and it filled in good. And I want to thank you for watching this, and I hope you learn to use, if you don't like Electrosurge, get a laser, but the laser is too slow. I'd rather have Electrosurge. I can go in there and I can cauterize everything, and I don't get the bleeding. And you make an opening where you can go in and hook your little, you make your hook after you do the thing before you start to try. Bond it, make sure you got the whole thing rigged up where you put the bond material, you put it there, your hook is already in place. And you let that set up good, and then you put your elastic on it to start pulling the tooth in with that. Thank you for watching, and I hope to see you again. And this is adult orthodontics, and this stuff should be done by the university-trained orthodontist. I don't care. I mean, this is ridiculous. A person goes to, I've talked to one, I found out one guy went through orthodontic schools, 2 or 3 years of that, and was using nothing but Invisalign, and he hadn't put a bracket on in 6 months. I thought, what ridiculous. Why did he even go to orthodontic school? He needs to learn how to do this adult orthodontics. There's a world of it out there that's going undone. Thank you now for watching, and I'll close this thing out.